All right, I think we'll get going here. This is thanks for joining today. This is Wishin's third, I believe, maybe fourth, Ask Wishin Anything. So this is a page out of the Reddit book of Ask Me Anything. Um, Through this, it's an opportunity for you all to ask questions of Wishin and learn about who Wishin is and what we do and status of certain projects that we've talked about. We do have a few slides that will share a few topics and points of discussion, and also updates about the organization and where we are headed. Ask that you please check in using the chat feature. If you could just drop your name, organization, email, if you'd like, to into the chat. But also through the chat feature, you can drop in your questions or use the raise the hand function that's built into Zoom. So, without further ado, we have again a couple slides, and I'll have Tom, Greg, Matt, Laura, and whoever else is on walk us through a few slides and get the conversation started.
Well, there are the slides, Steve. There's the agenda. So our plan for those of you who are here, and thank you for being here. I'm Tom Roll, the Communications Engagement Specialist. We appreciate your interest in Wishin. Our plan is to have Steve, Greg, whomever, give some brief updates on these 8 particular topics, and then we open it up to questions. And I will say, this is called Ask Wishing Anything for a reason. It's not Steve lectures to you. So Steve will speak and Greg and whomever on these topics, but we really want to hear your questions, your comments, your criticisms, any of that. Uh, uh, Part of my previous life was as a radio talk show host, and when people didn't call in, I said, okay, well, the show is for you, and if you don't have any questions, then we'll go on to the next thing. So what we will do here today is provide these updates for you and then really invite your participation in this forum and hope that you have lots of things to say to us. So there we go. We'll start with the latest on WISHIN 2.0.
Okay, I'll take that. Thanks, Tom. And invite Laura and others for color commentary. But the latest on 2.0 is that we are inching forward to an end of year deployment. We don't yet have a date. We are having constant conversations with vendors and managing this project, which is quite an extensive project, as everybody who's been part of the conversation knows. So we do plan to have some marketing out in the next maybe month or so that offer some sneak peeks, some sizzles, some creating some excitement around 2.0. But we are aiming for the end of the year sometime, and then future or in the near future, we will be sharing a date that we will be going live here. Again, any color commentary, please add it. Otherwise, we'll move on to DAV, Matt and Laura there.
Thanks, Steve. I can start with this and then Laura can add any details. So everyone, I'm Matt Jago. I'm WISHIN's Director of Population Health and Analytics. And for those of you who aren't familiar with the DAV program, it stands for Data Aggregator Validation, and it is an NCQA program which allows data flowing through the WISHIN network to be certified by NCQA and then used by health plans for HEDIS reporting. And we've been a DAV certified organization since 2020, and we are currently undergoing our every other year certification cycle. We're bringing 34 organizations, hospitals, and health systems through the certification process. which is a pretty significant increase over previous years. And this certification cycle is going to last through about the end of November, at which time we'll know which of those sites that we put through this certification process receive the DAV certification, and we'll be able to turn over to health plan customers for use in HEDIS reporting. And as always, our goal is to get all of the sites certified. And we think, or we have found or understand that it really can provide a lot of value back to a participating health plan. So happy to answer any DAV related questions later on in the session, but we just wanted to give a brief update on what that process is today.
All right. Thanks, Matt. With the minor safety plan bill, this was a study committee, or this began as a study committee with support from the Shishwamagan area. So Ashland and Bayfield, they created a safety plan that was available to first responders. Senator Jesse James authored or co-authored, but he certainly led the study committee through the legislative process. The minor safety plan bill is now Wisconsin 2025 Wisconsin Act 10, not to be confused with the other Act 10 from 2019 or 2020. But through this, we now have signed into law with Governor Evers and through joint finance budget allocation to fund the project, where WISHIN would be the state repository and network to move minor safety plan, to capture minor safety plans that will be available to first responders. That was signed into law just recently. We are in a holding pattern as DHS and WISHIN try to navigate who's going to own the policy side and then the oversight at the state level. But it's a huge win that throughout the state of Wisconsin, minors will be best represented that have mental or behavioral health issues, where first responders can work to de-escalate and identify those that need to be contacted to navigate those crises that those individuals might be going through. So more to come with that, but that is a huge win for the safety of minors that are experiencing crises. PointClickCare partnership. So WISHIN is working on a PCC or PointClickCare partnership that would move SNF and skilled nursing facility and assisted living data from those facilities that are using PCC, PointClickCare, EHR, into WISHIN, and then through WISHIN we can aggregate that with the other relevant clinical information that we have about a patient. That will help manage the care coordination that is expected or unexpected. Also help close the loop between SNFs and post-acutes or discharges from skilled nursing facility back into the home, where the care team can then have access to all of that relevant clinical information, where previously the post-acute skilled nursing facility, assisted living, etc., that data hasn't been walled off, but it's accessed in a different way. Our goal is to bring that all together harmoniously and have a single record of a patient's journey as they move into those settings of care. Moving to number 5 then, we are keeping a watchful eye on all of the federal actions that are happening. We are aware of two pledges, pledges to make data available to patients and enhance the prior authorization processes that some may say that are broken. We don't have an opinion there, but we want to help facilitate um, more expedient prior authorization processes. That's one of the four approved purposes for health plans to use Wish and Pulse, and want to see how we can support the automation of prior authorizations. And as it relates to the pledge of data exchange and making data available to patients, that is always, well, that has been on the table for a number of years, maybe decades, we might say. And with that is understanding what WISHIN's role is. We don't have direct access to patients, and nor do we want to. We want to play the role as the last mile and the convener between providers and payers in all settings of care, and the collector to improve quality and et cetera. But again, as it relates to federal actions and health data sharing, we are we are mindful of what's going on, and we will continue to communicate where we think we can add value, and where we might partner with other organizations to move the ball. But our focus is our governance and supporting our participants' needs. And then I'll hand it off to Greg and Matt related to SDOH screening exchange workgroup.
Thanks, Steve. Just a few items on this work group. So earlier this year, we put together a work group of WISHIN participants to begin discussing the possibility of exchanging social determinants of health or health-related social needs information between screening information between the WISHIN participants. That work group has had really robust attendance. We've had around 25 organizations represented in that work group. And really what we've focused on is two things, I would say. The first is the mechanics of exchanging that information by both the health systems and hospitals and the health plans. And we've also spent quite a bit of time talking about the legal and compliance issues related to exchanging this sensitive information. And so we think we've nailed down some common mechanisms that we think health systems and hospitals can submit this type of screening information to WISHIN. We continue to work with the health plans because there's a variety of different ways that the health plans collect this data to determine how it can be contributed to WISHIN. And then we also are continuing to have ongoing conversations again about the compliance piece of sharing this information. The other thing I would say is, and Steve is about to talk about the participant advisory board in a minute, but what he'll highlight is we are also working to clarify within the WISHIN participation agreement that the sharing of SDOH and health-related social needs screening information is a permitted use of the WISHIN network. So if you're interested in the work of this work group, please feel free to reach out to Greg or I, and we can get you looped into the committee.
Thanks, Matt. Appreciate the segue into the participant advisory board. As Matt said, we are advancing the ball on a number of opportunities to modify the data sharing participation agreement. The process is to use a participant advisory board, which is a 15 or 16 member committee that's a representation of all participants on the network. Those representatives are from health plans, health systems, critical access hospitals, DHS, etc. So we WISHIN presented a number of modifications that include expansion of what was a more narrow public health use case to a little broader to align with federal regulations. As Matt said, adding a specific data contribution type to be SDOH or health-related social needs. There are also net new use cases to the participation agreement that include the use of population health data assets. So looking at cohorts and not then limited only to patient by patient lookup. That'll be a new service offering that comes in the future. All of the modifications we presented to the participant advisory board were passed unanimously. The process now is to move all of those modifications to the board of directors and seeking adoption of all of those, which then will be effective 90 days after that vote from the WISHIN board of directors. So more to come there. During that 90-day period, all participants will be notified of all changes and actions organizations can take. And then we'll wrap up. And we did get a question from Dr. Lang. We will get to that as soon as we complete item number 8, which is new customer diversity. So Greg and others that are walking through that, please.
Hey, this is Greg. If you don't mind advancing 2 slides, I thought it was interesting taking a look at, we have 30 new WISHIN participants in the past year, and it was just kind of interesting looking at how diverse it is across sectors. 5 hospitals, 5 home health, 4 public health, local public health, as well as pharmacies. I can see 1 new health plan as well as independent clinic, and then kind of a handful of EMS, free clinics, and ADRCs. But just thought, I really, when I think about the healthcare delivery system in the state of Wisconsin, I think this is really representative of all the different types of organizations that benefit from our state HIE. So thanks for letting me share.
All right. Thanks, Greg. So the first question that Dr. Lang dropped in is a very good one. How is collection of healthcare power of attorney or advanced directives going? So Dr. Lang and to the group, there has not been, and I should say WISHIN was not designated as the state repository. There was some conversation. I'm not sure if there was policy or law, but there was something that was in the mix, I might say 5-6 years ago, where there was a repository for advanced care planning documents or ACPs. WISHIN feels that it can fill that role. It is in our wheelhouse, and we are seeing some, and I want Laura and Matt to fact check me here, but we do see, from my understanding, some advanced directives or advanced care planning documents in the network today. While we work through and complete the WISHIN 2.0 technical transition, really want to have a broader view of what types of ACPs exist in the network and how we might be able to communicate to honoring choices and health systems and other organizations across the state, how WISHIN can be leveraged as this repository to fill the need for advanced care planning and informing care providers the desires of patients as they enter their healthcare facilities, rather than somebody having to walk around with the ACPs in hand or pull them out of the freezer or wherever individuals keep their advanced care planning documents. Um, so the collection is happening, but there's not an intended or focused priority at this time to expand this. And happy to field any commentary from others on the call, how important it would be, or it is within your organization to have access to those ACPs. That'll help drive some of our strategies going forward. Okay, thanks, Dr. Lang, for breaking the ice there. You can use the raise a hand function. You can use the chat. As Tom said, we are here for you. Yes, the Brewers are on a 10-game winning streak, and I do believe they're going to win the division if that's a question. If no questions, are there topics that folks want to discuss? Here's Jackie. I'll yield the DAV questions to Laura and Matt. But the question is, when DAV data does not get certified, how does WISHIN work through the discrepancies?
We've done a couple things. Unfortunately, there have been a couple of circumstances where we did not get a certain what they call cluster, which means a group of like workflows, usually the same EHR and the same care setting. There have been circumstances in the past where like clusters did not get certified. And the first thing I wanted to note, when that has happened, it has not happened because our data was different than what the data was that was coming from the healthcare system. There was more of a discrepancy between what the data revealed in both pieces of the information. So, for example, one of the times we had an issue with the LOINC code for a test and the lab and the description of the LOINC code didn't match up with each other. Our system showed exactly what the EHR system showed, but it was considered a failure because of that. So it again, it depends on what is considered the quote failure unquote as to what we think is really a quote discrepancy or if it's just kind of real auditing itself. Anyway, we notify the customer of what may have been the case so that they can look at their own data. We also will work, depending upon what has failed, what is not considered passed. We have worked with individual payer organizations then with their auditors to have their auditors, their HEDIS auditors, independently validate the data themselves so that we're not hindering the payers who have subscribed to our DAV processes. We have done that in the past. Now, we're very, very hopeful that nothing doesn't not get certified this time, but we're being, again, very, very careful about making sure that, the tests that we're displaying and that we're getting from the medical records are, matching each other. And we've always, like I said, any of the discrepancies have not been because we're not showing what the medical record shows. It's more looking at how the codes and the descriptions are linked together.
I would, Laura, would it be also be accurate where we have non-certified sources, WISHIN can still be a source of non-standard supplemental data that would otherwise have to go through primary source verification with their HEDIS auditor. So we can still be a source of non-certified data.
There was also a question, is there a contact person to reach out to for WISHIN questions for inclusive staff? We do have a support mailbox, which I'm putting in the chat. I'm also very available. If someone sends me an email directly, I will work with your organization on any questions that you have. I manage our support team along with our implementation team, which tend to be the same people right now. But I'm also available for questions if your staff wants any additional trainings or anything like that. Reach out to me directly. I can make sure that we arrange that. I don't know if this group is aware or any group is aware. If you have access to the WISHIN Pulse system, we have added a link to a training video that walks through the WISHIN Pulse system itself. So any new users that you add to WISHIN, because WISHIN Pulse organizations that are participating can manage their own users. Any new users that you add to WISHIN Pulse, if you don't want to go through any kind of a formal training session with them, you can tell them to access a link in WISHIN, and I can share where that is a little bit later, if you want to let me share my screen, I can share where that is, which is a video that walks through WISHIN Pulse. It's an 8-minute video that walks through all the functionality and talks about initial setup as well. It's also on our website, I believe. If Tom has that link, he could throw it in the chat.
And Steve,
Laura, I had a follow-up. Can you hear me? I don't know if Laura can hear.
yeah, so Steve, I can answer your question. So Steve's question was, if there is some data that does not get certified, either through the certification process or because we have a new hospital or health system join after we go through the certification cycle, yes, we can send non-certified data to health plans, and health plans will then work with their auditors to get that information certified. So yes, we can be a supplemental source of information, whether it is DAV certified or not.
Thanks. All right. We did also have a question from Moretta Camp. I hope I said that right, Moretta. Regarding immunizations from Duluth Essentia Health, patients not getting into the Wisconsin Immunization Registry, I believe. I would suggest that Essentia reach out to the Wisconsin Immunization Registry directly. WISHIN does not manage the WISHIN or the Wisconsin Immunization Registry that's run out of Department or the Division of Public Health. So if there's any follow-ups to that, let us know, or if you need those contacts at where we can help navigate that process. Otherwise, anything related to WIR is outside of outside of the scope of the WISHIN network. I did drop the link that Laura referred to, the WISHIN Pulse tutorial. That's a direct link to the our YouTube, or the video on our YouTube channel. And I think that addressed Rebecca's request. Laura, there's a question here to you. Do you have an email for us to use for questions, etc.? I don't see your contact in the inclusive list. So Nancy, I would say that support, or there's Laura's direct email. Thanks, Laura.
I also see a question here
included a
from
link. Yeah, I included a link to our contact page on our website as well.
Thanks, Tom. I see a question here from Chris Graff, wondering how do we get more organizations to participate in WISHIN?
This is Greg. I can take that one. Many different ways. Sometimes word of mouth from other customers. Sometimes other customers approach another clinic and say, "Hey, we'd love to get your data in." And so sometimes it comes kind of word of mouth. We do a good amount of speaking at conferences. I'm actually at the conference today, so sometimes just presentations, meeting colleagues. But I think word of mouth, especially in the same industry, when one public health gets on, they talk to their colleagues, for example. So we between Tom and then Carol, who's not on the call today, we have a team that does kind of customer outreach and engagement. Always looking to fill out the network. I think a buzzword we hear in health information exchanges that I think is really true for us is the last mile. We have over 80% of hospitals. We have really a critical mass in the state. So how do we fill in some of the white space we have left? So hope that was helpful.
Chris, I would also add that DHS has, specifically the Division of Medicaid Services, has been a strong supporter of the WISHIN network and has implemented a pay-for-performance incentive that has now moved to a withhold for eligible hospitals across the state. So I think there's 166, 67 eligible hospitals. WISHIN now has 80 or maybe just over 80% of the hospital network participating. So there's been great effort there, and thanks to Krista Willing, Nick Havens, that the Medicaid team in making that happen, and they're advancing the ball, and they see again the value of WISHIN. We are working with a number of membership organizations, Pharmacy Society of Wisconsin, to bring in pharmacies. We are in discussion with post-acute member organizations to bring in SNFs, to bring in assisted living facilities. We've partnered with Wisconsin Association of Free and Charitable Clinics, and that is our goal, is to work with, we will work one-on-one, but where we can cast a wider net through membership organizations and some type of membership benefit and incentives. That's how we see the catchment being able to come in mass rather than one by one. With 80% hospital participation, we are definitely moving the right direction. There are a few holdouts, and in the inclusa market, or near the inclusa market, Aspirus is still not participating, and we are doing as much as we can to get their attention to come into the network. It does take some effort on organizations that also want that data to be represented and available in WISHIN to help move the needle. as Greg said, through conversation, through values, through other means necessary to get that data in. So a lot that's working to get ubiquitous participation in the state. Ascension, just to be clear, Chris, Ascension is in. All of Ascension is in. So if there's data you're not seeing from Ascension, let us know. But that may be something missing from Ascension that maybe we don't have the full membership roster. And just to be clear, payers that have multiple lines of business, that we can partner with any line of business. It does not have to be limited to Medicaid. We're working with some Medicare Advantage programs. So if you're not seeing data from some of your members, let us know and we can look at your membership roster, make sure that's inclusive of everybody. Is Marshfield Clinic in? Yes, Aaron, Marshfield Clinic is in. Laura and her team did a fantastic job spinning them up a while ago, so I don't know the exact date, but yeah, Laura, if you have anything to add, but I think they're sending everything and they have for some period of time now. Essentia Health. So we're working with Spooner, and then there's also efforts to work with Superior, maybe in
Correct.
Hayward.
Yep, and this is Greg. I've actually been in talks with Essentia. You know, their Superior is the one that's currently a holdout. You know, they are eligible for this incentive from DHS. So in talks, they haven't crossed the finish line. But hearing from our partners that are already in the network that it would be valuable is really helpful.
Yeah, so thanks, Laura. Tamarack and Spooner are already live. Duluth, I think there was some conversations about Duluth and Essentia. They could be in. They are the Minnesota laws for patient query are much, much different than Wisconsin. So a careful consideration would have to be taken how Duluth data is shared. But any Wisconsin-based hospital, that's much easier to navigate than Minnesota law.
Hi, this is Moretta, and yes, you said my name correctly. Thank you. That would be amazing, simply amazing for both of those, both Aspirus and Essentia. So thanks. Keep the good work going, guys.
I appreciate that, Moretta. If there are provider contacts that maybe Inclusa Humana can work with WISHIN to do some joint outreach to Aspirus to close the loop there, that would be extremely helpful. We are open to having some joint conversation why it's so beneficial to the health system to participate as a benefit of member care coordination, etc.
Okay, I will reach out to my leadership and have someone reach out to you guys.
Thank you.
That's
Yeah.
fantastic. One other, and I skimmed over this in the updates that we previously talked about, the Participant Advisory Board has also approved a modification to use case number 8, which use case number 8 defines the permitted purposes for health plans to use WISHIN Pulse. Today it's care management, collection of quality data, claims adjudication, and prior authorization. The PAB approved risk adjustment and risk management as a 5th approved use case. So with that, we think that is definitely going to help in the management of, well, utilization management and other benefits of having risk adjustment, risk management being an approved use case. So hopefully that'll help move the needle as well as the shared relationship of risk through whatever value-based programs might exist between a payer and a provider. So that is also coming as part of the modifications to the PAB. So Prevea does not always have everything in the site, etc. documents. Just to be clear, Prevea Health uses the HSHS Epic instance, but Prevea Health does not participate at this time at all. They do not use or contribute. So if Kathy, related to Prevea, if this is a gap that you'd like to close with Prevea, or you're from Prevea, I'm sorry I didn't track where you were from, we can have those conversations. But that's we understand that vacuum, and we would love to close that out in the Green Bay area and wherever else Prevea is represented. Okay, thank you, Kathy. And Moretta and Kathy, though you can reach out. I'll just, Greg, is your information in here? Or I think WISHIN is in here. We have multitude of ways to get a hold of us. Don't use the online form, just use this email. There. WISHIN@wishin.org. That'll get to the right people.
Steve, there was an earlier question that may have slipped by. As many quality measures are transitioning to electronic reporting, might WISHIN be considering institutions to join the network?
Laura, Matt?
Yep.
Defer to you. Greg, whoever
I
else.
would say I've been in several circles over the past year where that has been brought up as a missing data element that would be valuable to the network. We actually have done a little bit of outreach to Shopco, which has a bunch of ophthalmologists. But yes, trying to see how we get into, because it's kind of the more retail space than traditional clinic. So that's validating to hear that others are interested in that data as well. Something we'll continue to pursue.
And there's
and iInstitute we do
clinics.
have. Sorry, the iInstitute we do have through Freighter's instance of Epic.
Okay.
And can I just mention, there's been a few questions about Essentia and
Yeah.
Tamarack and things. So I just want to kind of explain what's live with WISHIN, with Essentia, and what isn't. Essentia Health by itself as an entity is not an actual WISHIN member, but a lot of its Community Connect organizations that use Essentia's instance of Epic are. Not a lot, but so Tamarack Health, which is Ashland and Hayward hospitals and all of their clinics, went live in Essentia's interfaces in mid 2025. So we are now receiving data from Ashland and Hayward that are now joined as Tamarack Health. Spooner, which is also a Connect, not owned by Essentia, but Spooner Health System is also using Essentia, their Epic, and they have been live for a couple years with the Essentia interfaces. So those organizations are sending us data through Essentia's Epic systems, but the other Essentia organizations or Essentia in and of itself is not live.
Rebecca, are you hoping that maybe if that would change in the future with Essentia?
Any other questions that we missed? Or any other topics for discussion today? There is no penalty for ending early, but we do not want to pass up an opportunity or miss an opportunity to address any questions that you all might have. And I really appreciate Humana's representation here on the call. All right, anything else from the WISHIN team to bring forward?
I would just like to thank the participants today, Steve. This is why we do this. We had a lot of good questions today. We want to answer people's questions about what WISHIN does, what WISHIN is doing, and this was a good one today.
I agree. Well, with that, we will see you all next time, and please don't hesitate if you have any questions. You have our contact information. Thanks all. We'll
Thanks,
see you then.
everybody.
Take care.